These side effects, I mentioned to you before that constipation is universal, that nausea is common, maybe 30% of the time, but temporary, wears off in 5 days. Sedation, very common in an opioid-naive patient, wears off within 48 to 72 hours. You have to tell patients that in advance, or they will stop the medicine, thinking that they're allergic to it. Urinary retention is particularly an issue in older men who have BPH, middle-aged men. Dry mouth is common. Uncommon side effects are depression, dysphoria, and that seems to be a genetic predisposition. Some people get dysphoric with opioids. They need it for the pain, but it makes their mood miserable. In patients who are dehydrated or have renal insufficiency, or who have been on high-dose opioids for a long time, myoclonus muscle twitching that can lead to seizures can occur. Some patients, again, it's impossible to predict who will develop itching. And if we're not dosing properly, if we're dosing way too high in an opioid-naive patient, we can cause respiratory depression and respiratory arrest. And delirium occurs in concert with the sedation, particularly in people who are at risk for delirium to begin with, such as people with dementia or stroke or Parkinson's disease or frailty, as opposed to just sleepiness. Okay. And as I said, nausea and somnolence are common and they wear off. Constipation is inevitable. Tolerance does not develop over time. It is critical to tell the patient to begin laxatives prior to beginning the opioid and to use them every day, whether they need it or not. In the States, we have access to something called polyethylene glycol powder. The brand name is Miralax. Very effective, low cramping. It's a powder that you mix with water. Senna is also effective, but more associated with cramping than polyethylene glycol powder. Do not use stool softeners, Colace. There are now 2 randomized controlled trials that show that it is no better than placebo and it is not cheap. So don't bother prescribing it, it doesn't work.